Hello, this is Dr. Himanshu Trivedi. We will continue with our series on medical diseases for the common man. The channel is MedNo. Today we are going to discuss is about the coronary artery disease. Heart supplies blood to the whole body, but heart itself is a muscle, so it requires blood for its own survival. So the arteries which supply the muscle of the heart are known as coronary artery disease, coronary arteries. There are two, left and right. So there are two coronary arteries, one to the right and one to the left. Left one is divided into a number of branches. There is a left main descending. There are many others like circumflex artery. When these arteries become narrow or they block, then the person gets pain in the heart. This is known as coronary artery disease, CAD, which it is popularly known as. Most common cause of coronary artery disease is atherosclerosis, that is fat deposition or a plaque forms inside the blood vessel. Because of that, the narrowing occurs. The supply becomes less. Supply becomes less means oxygen supply to the heart becomes less. As a result, the person gets pain. Risk factors. There are two types of risk factors: non-modifiable and modifiable. Non-modifiable means you cannot do much. Example is the age. As the age increases, chance of a coronary artery disease is much more. It is more in the males than in the females. Menstruating females usually are well protected because of their hormone and a very strong family history. When I say family history means a strong positive history in the father or mother. Basically, what it means is father and mother had a ischemic attack or a heart attack in the past, or had a history of angina in the past. Then there are modifiable causes. Smoking. As I have said before in my lectures also, one should not smoke. Even one cigarette a day, no. That is dangerous. High blood pressure. Pressure systolic, that is the upper pressure should be between 100 to 140, and lower one, which is known as diastolic, between 70 to 90. Hypertension is a huge risk factor for coronary artery disease. Then the high cholesterol, particularly the dangerous one is the LDL cholesterol. I will be taking a lecture on cholesterol later on in this series. But LDL is the one which is dangerous, and it should be less than 100. Obesity. Obese persons are more likely to get. That does not mean that a thinner person would not get. So one should be careful. I am thin, so I won't get a heart attack. No, that doesn't work that way. And less physical activity. One should exercise. Beyond age 50, instead of going to the gym, just walk 4 kilometers a day. I've been insisting on this again and again. One should walk 4 kilometers a day, two going and two coming. Importance. It is a leading cause of death worldwide. That is its importance. It is a leading cause of death worldwide. When the supply to the heart is less, we call it angina. This is in very simple terms. I'm trying to explain that what is angina and what is myocardial infarction. Not exactly the way I tell you, but angina means there is still some supply to the heart. When the heart supply gets totally blocked, that is when person gets myocardial infarction. Myocardium is the name of the muscle of the heart. It has got three parts. The outer one is the myocardium. When the supply to the myocardium is stopped, the cells of the myocardium will die. As a result, that part of the heart will not be able to function, and this would lead to heart failure. So today I explained three things. One is angina, second is myocardial infarction, and third is heart failure. Heart failure means what? The heart is not pumping well. Right? The job of the heart is simple. It is a pump of the body. It pumps. As a result, the blood goes everywhere, right from the head to the toe. So, if myocardial infarction occurs, the cells go dead. So that part of the heart is not able to function well. So the pumping will decrease, and that will lead to heart failure or sudden death. Key thing is coronary artery develops over years. Over years, there are modifiable factors. If we control them, it can be prevented. Otherwise, it can lead to sudden death. Thank you.